So let's just start at the beginning. Can you explain for our viewers what is anxiety?
Sure. I think we all know what stress is. We're trying to get to work and we unexpectedly hit a lot of traffic and we're going to be late. That is a stressful situation. Anxiety is the additional layer that happens on top of that, where we're catastrophizing about what that moment means. We add things from outside the script, like, oh my gosh, if I'm late, that means, my boss he's gonna be so mad at me, I'm gonna lose my job's gonna be at stake, just the domino effect of things happening. So while stress is something that happens in life, traffic jams happen, water heaters break, things like that, anxiety is really optional. We can decide whether we go ahead and sort of feed that narrative that goes on top of the stress, or whether we can do something else.
So you talked a little bit about procrastination. Could you define procrastination for us and give some examples of how someone or how you've seen your patients engage in procrastination behaviors?
Sure. So in a nutshell, it's putting off to tomorrow what you should do today. It's letting your feelings of fear about how something is going to go get in the way of your actually approaching the situation. And that's really what I see so much in my practice and in my own life from time to time. No one is immune. We have to keep on top of this. But, that a lot of times when we're avoiding a project or something, well, I'll say to a patient, well, what are you afraid of? What do you think is going to happen? I don't know. I just, what do you think is going to be the hardest part? I don't know. There's sort of this paralysis. They get frozen with fear about it. But one of the strategies that is very low-tech and simple that I suggest is don't be shy with the project that you have, in front of you. Take a look. Go and see what it is that you have to do. You're not committing to working on it, but just go, open that letter that you've been afraid to open, or that email that you've been, or peek into your kitchen. Are the stack of dishes really as high as you're thinking? Because often when we look, we see that the situation is more manageable, that we are capable, fully capable of handling it. And most times we are going to do that eventually anyway. Why not save ourselves the anguish of that sort of last minute, deadline, and really get the job done well. And there's also panic disorder, which, people may sort of talk about, I was in a meeting and I really panicked. That's not the same thing. What happens in the rest of that story? After they panic, they pull it together and, it's just a moment where they weren't sure about something. Mm-hmm. True panic disorder is having an out of the blue surge of anxiety and dread that escalates within minutes, where you feel like something terrible is about to happen, you're about to, have a heart attack or die, and that you have just a surge of physical signs of anxiety, heart racing and shortness of breath. That's different from I panicked and I was okay. I want to say though, Carl, that your listeners may be thinking, yikes, this does not sound good. Anxiety disorders are the most common psychiatric condition, and they're also the most treatable. So if folks are suffering with these conditions or have questions about them, please know that there is excellent help available and that life can really be different.
Your book. Are there any final points you would like our viewers to remember from this program and from your book?
Yeah, I think that it's, I'm very aware that, anxiety is the most common condition. So there are probably a lot of people listening thinking, well, this is all well and good, but I've been this way my whole life. So this is just who I am. There's nothing I can do. But there's a quote that I use in the book that I think just speaks volumes, which is a Chinese proverb that says, the best time to plant a tree was 20 years ago. The next best time is now. So if people just work, take one or two ideas, maybe even from this conversation, and start using those, they're changing their relationship with their worry. That's really, the brain is going to like that, and it's going to learn that new trick.
Well, and that's a very good one. So I'm going to take your good advice and go back to my office, a calmer and happier man. So Dr.
Sounds
Tamar
good.
Chansky, thank you so much for joining us today on Book Chat to discuss your latest book, Freeing Yourself from Anxiety, 4 Simple Steps to Overcome Worry and Create the Life You Want. I'm Carl Helliker, and you've been watching Book Chat.